Now you've tried your hand at using positive communication to help Paul talk to his mom about Mother's Day. It's important to note here that we're using our imagination because Paul's not a real person and he's not a real client sitting in front of us. So we're imagining what he might say. In real life, with a real client, it's of utmost importance that the words that the client ends up using are their own, that what they're communicating is true for them. And although this style of communication might be a new way for them to try talking to their loved one, it should still sound like them. We are not telling them what to say or scripting their words for them. And that means that we could use this same positive communication skill with 100 different clients with a very similar issue, and we will come up with 100 different things that they're going to say. With that in mind, let's take a look at what I imagined when I thought about applying this positive communication to Paul. Now let me show you what I imagined Paul might say if I had worked with him on this positive communication exercise. I know that Paul wants to see his mom for Mother's Day. He just doesn't want a repeat of Easter. So I used that as my positive statement. Hey, Mom, I'd like to have a really good Mother's Day with you. I imagine what he might be feeling that he'd want to communicate about how Easter went and use that as an I statement. I feel pretty sad about what happened at Easter. Remember, we want to be able to find an emotion word in the I feel statement, and here I have sad as the emotion word. Now he's going to express understanding. I know hosting can be stressful, and you'd had a few drinks to try to relax. You can notice here that probably Paul doesn't agree with that statement about alcohol being helpful to relax for his mom, but it doesn't matter that he agrees or doesn't agree. He's expressing understanding about his mom's perspective, how she feels about it. Understanding statements can go a long way to reduce some of the defensiveness and hopefully let Paul be able to communicate his main message to his mom. For shared responsibility, I imagined that he might say, my siblings and I could have offered to help more to ease the stress on you. And finally, a potential solution. I'd like to have an enjoyable and sober Mother's Day celebration. Could I host a brunch for you at my house and we can keep it alcohol free? And remember what I said earlier about this positive communication not being a way for us to script what our clients should say. So here we're a little challenged by having to imagine what the client might think or feel that they'd want to communicate. So if this were real life and I was really working with Paul in my office, I would make sure that these were the things that he wanted to communicate, that the feeling statement, the understanding statement, his solution were coming from him, with me teaching and guiding him in the model, but not telling him what he should say to his mom. So you may have come up with different things when you imagined what you might say with the client and filled in the survey in the previous slide. And we might have different things that we imagined. It doesn't mean that one of us is right and one of us is wrong. It just means that we're using our imagination and we don't know what Paul really would say. Now, if Paul were in my office and we'd completed this part of the positive communication strategy, what we would do next is to practice. First, I would make the entire statement in order to Paul, telling him to just respond to me like he is his mom and I'm him. After he's able to hear what it sounds like as I read through the entire script, I then ask if there's anything he wants to change or any amendments that need to get made, and then I have him give it a try. I have him read the entire thing to me, and I respond similarly to how he showed me his mom might respond. And in doing so, we address any obstacles that he anticipates, including maybe her getting upset or arguing on some of the points. And he both gets to hear me stay with the main message and script and not get drawn into an argument, and he gets to practice doing that as well. I might practice numerous times if the client needs that to feel more confident in giving it a try in real life. And then I ask them if they feel like they could do this after the session's over in real life? Could they go home and use this positive communication strategy? It's way more important what our clients do after they leave our office than what they practice in our office. Now that we've done a little bit of practice together, let's back up and look at the big picture here. If we're using craft with clients, we'll be meeting with the CSO, the concerned significant other, likely without the patient, the person with the substance use disorder, because this was designed for people who are refusing treatment, so they likely won't be in your office. It will be the family member of the person with the addiction that you'll be working with. You can provide craft individually to them or as part of a family of people coming in together for counseling or in a multifamily group setting if you're doing craft-based groups. You're going to model respectful, non-stigmatizing language. You're going to model a non-confrontational approach in the way that you work with the family, and you're going to model respect for each person's autonomy. You're going to teach a series of skills to the concerned significant other. You're going to have them role play with you, like we just discussed with the communication procedure, and you're going to have them practice the skills between sessions. Remember, it matters way more what somebody does with the skill outside of your office than what happens in your office without their loved one present. You're going to help the concerned significant other to communicate more directly and positively and respond differently to their loved one's substance use. No need for threats or punishments. You're going to assist with treatment navigation when the patient agrees to treatment. That's part of the treatment engagement procedure. If this short introduction has piqued your interest in craft, something you could do next is to get the Provider Craft Treatment Manual. The treatment manual has detailed instructions for each procedure in craft. I recommend you buy it from the Guilford Press publisher's website because you'll have the option for a printed book or an ebook, and you'll get a free downloadable packet of materials, including handouts that you can use with clients and in your learning process. Now, I know many of you might have come to this class with other experience that you already have in other modalities, and some modalities go very well with craft. If you are already trained in motivational interviewing, you'll see that the spirit of the two approaches work very well together. If you're trained in any cognitive behavioral therapy type modalities, including CBT, DBT, or ACT, then you'll see that there are some skills that you may already know that will help you to learn craft. I also find that craft works very well with the harm reduction approach, especially in the respect for self-determination and respecting many different paths to recovery. Also, you heard me reference some things about systemic ways of thinking about families. If you're already trained in a systemic or strategic approach to family therapy, then this will be an additional skill set that you can use in that context. And if you happen to be trained in alcohol behavioral couples therapy, you'll see quite a lot of overlap in the skills. If you have some clients in mind that you think could benefit from this approach and you want to direct them towards this kind of help right away, here are a few resources for you. There are two main books that outline the craft method: Get Your Loved One Sober, which was published by the developer, Dr. Myers, and co-author Brenda Wolf, and then a newer book published by people who were trained in craft and added some additional material to write the book Beyond Addiction. That's a book that most of my clients have read and really appreciate. The best place to find any of these resources, including craft-based groups that are available now, are the website Helping Families Help. You'll find both a provider side and a client side of that website with very valuable resources. As a provider, you can go to the Helping Families Help website to find other providers doing similar work using craft or a similar approach called Invitation to Change, and many other helpful resources for the provider wanting to learn craft, including listings of upcoming trainings. You'll also find a survey at the end of this course asking about your interest in learning craft, and you'll be able to add your name and email to a list of interested people should a free training arise for providers in Nevada?